How's everyone doing? Hey,
Hi, Dr. Brooks.
how are you, Emily?
Living life. It's neuro. That's all I can
Yeah,
say.
I know. Yeah, that's all. That is all you need. So, but the good news is, once you're done with neuro, it's downhill, and you're almost halfway done.
If you make it and you don't have to remediate, right? Just
Well, I'll tell you, most people feel like they're going to have to remediate all the way through the class and probably a week or two after. And then everything magical comes together and you're fine. So, um, tonight, what we're going to do is the first hour is going to be on identifying vaccine hesitancy. We'll classify it and we'll dig in a little deeper on some of the roots, and I'll show you. We'll actually go on to some of the pages that are on Facebook, and I'll show you some of the different responses, and or we can have a discussion about what that looks like in terms of classifying it and maybe how we would discuss it. We'll do a little bit of a classroom activity on it. And then the second hour, we'll do motivational interviewing. So we'll discuss how to respond to vaccine hesitancy in the clinic. There's a couple things that are coming up. So this week is vaccine motivational interviewing and hesitancy. Next, we'll skip a week, obviously, for spring break. And then the week after that, we have our SP, second SP. This lecture should give you a really solid foundation for what you can try. No one's going to pretend that you're going to be super duper at it. We're just going to give you an opportunity to kind of explore that and what that looks like. And hopefully tonight, as you go through, if you've had the experience of interviewing or talking to people, you can start to really conceptualize what that looks like. You can be like, oh, when they said this, I should have done this. That's the goal of the SP and to start off with, is to give you a little bit of a framework. Then we do one more session, classroom session, and then we have a real treat. Gina Folia she is a faculty member in Utah, PCM, but she's an adjunct faculty here in Utah. She has worked on several vaccine programs, including at COVID vaccine one. And she's also now works for BARDA doing the Department of Defense, and she has some really exciting projects that she's working on in the vaccine world. And she's going to do lecture number 8. She and I are really good friends. In fact, we go out and do stuff with them all the time. So it's she's a great resource for me, and she will be for you as well. So that's kind of the schedule coming up. We also have a reflection that's the capstone to this course. And basically, we're going to be looking for a 2 or 3 page document reflecting on, and I would in particular like you to reflect on your SP experience, what you feel like you learned from your SP and how you think it's going to affect your practice. That's the prompt that we're going to give you, and hopefully that kind of lends itself to how you write that. So, okay, write that up. So that's coming up. That's not due till well after the class is done, but I'm going to give you a heads up now that that's your prompt, and so you can start processing what that looks like. And if you want to get it done early, I actually wouldn't encourage it, but you can probably get a little bit done and started. But I would wait till you get done with the SP, because that might be very fruitful for you. Okay, so let's talk about vaccine hesitancy. And today is going to be a little bit hands-on E. So let's see what that looks like. Does anyone have any questions so far? Okay. This is kind of, I think this encapsulates very well the cognitive dissonance that can occur.
Dr.
Obviously,
Brooks,
yeah.
switch your displays.
Thanks. Actually, I'm going to stop sharing and I'm going to thank you for pointing that out. We're going to go this way though. Is that better? Okay. So, and this kind of displays kind of this is exactly how some of your vaccine hesitancy will come across to you. You'll be like, but you have all those tattoos. How can you hate needles? Like that's literally what's going to come across in the back of your brain as you're dealing with your patients. It doesn't we'll teach you how to identify this, teach you how to discuss it with the patients, and we'll get you to the truth is we all do this. So it's really easy to be like, that doesn't even make sense. They're whatever they are. And the truth is we all do this. This is all part of just the human experience. We all do this in one way or another. So it's really important that you're empathetic and you show some compassion to people as they just try to do the best they can. Okay, let's talk about. So one of the things that I like to start with is I like to talk. I'd really like to talk about actual risk versus perceived risk. Okay, so if you look at vaccination down here, what you're seeing is this is a chart that shows actual risk versus frequency in newspapers. So how much does the news media actually play this? And there's been times that I've been watching the news and they'll show somebody on the news who talks about how their son developed autism or developed some kind of adverse event, and the newspaper runs that, or the TV runs that as a leading story in the news. And my brain just explodes like at that point, because like if you look at things from a perspective of actual risk and scientific validity and validation, vaccination is one of the most well characterized, well understood risk factors that exist. And yet we have such a huge amount, and this is pre-COVID, huge amount of press that's given to articles on autism vaccines causing autism or vaccine adverse events, where if you look at all of these things, nothing is compared to how much press that we get. Some of these things have a huge risk. Autism from fraternal twin, injury to cerebellum at birth, identical twin is autistic, premature by more than 9 weeks. So some of these things actually are real risk. Some of these things are actually just perceived risk. Okay, let's talk about the spectrum of vaccine hesitancy. This is probably one of the most important, and I got this pre-COVID. So this is gonna change. But what we're talking about is the spectrum of how people are willing to accept a vaccine. So there's some people who will accept all vaccines without question. Okay. There's accept, but have some doubts. Honestly, I'm probably in this light green area. If you want to know the truth, I don't accept all vaccines. I actually will be a little bit skeptical of them at times. So this is where I fall. I don't just go take it. I take a lot of vaccines, most vaccines, but I don't take all vaccines without just considering them. Here's some people who delay and refuse. And you'll notice that as we kind of get to some of the more vaccine deniers, the numbers are decreasing. And in the old days, this was the total sum of a vaccine denier. Like it was like less than 3% of the population was a vaccine denier. This number is obviously significantly higher now. Vaccine refusers So vaccine, the difference between a vaccine denier and a vaccine refuser. A vaccine refuser is not going to take the vaccine, but they're not going to try to recruit anybody else. A vaccine denier is someone who's actively trying to recruit someone else. And there's a large chunk of people who accept most vaccines. They might have specific hesitations on specific vaccines, or they're going to delay some vaccines, or they need a little bit of additional push. But this is kind of what you're going to see with the spectrum of vaccines. And I would actually argue that the vaccine and refusers now all could almost total a third of all people, which is really, really scary in many, many regards. And I think this statement, this quote, as people fears of the diseases abated, this is things like polio and cholera and pertussis, their concern for side effects of the vaccine increased. That's the risk trade-off we're looking at, and that's why we see what we see. So again, vocal vaccine denier, they're actively recruiting people to their cause. Vaccine refuser, and they level this is very low or zero. I don't know if that's true anymore. Vaccine refuser is low. They actually are just going to not take the vaccine themselves. And then we have vaccine hesitant, which as we get into this, you're going to discover we're probably going to be targeting the vaccine individual, the hesitant individual. And we're not going to be recruiting we're absolutely going to ignore the vaccine denier. And we're going to have a really serious conversation or thought process before we engage with a vaccine refuser. One of the things that's super problematic is our decreasing vaccine rates. And what you're seeing now is in 2010, we had a 3% refusal rate. That is tolerable. Okay. We would have pockets of people, certain religious communities, certain socioeconomic communities would be less open to taking the vaccine and flat out denying it. And once you get, especially in those communities, there's a real problem. And there's public health officials are the people you need to be contacting if we have a great number of certain communities who are taking or who are, and you're not tattling on them or anything. You're just going to recognize that there's increased things like measles that can occur in those communities, and the medical community, the public health communities need to know that there's a possibility of certain things going on in those communities. This is how we deal with, or how we process vaccine hesitancy. One of the most important things that we're going to be dealing with as we deal with vaccine hesitancy is we're going to need to identify what the actual concern is. So there's certain things that are confidence, their trust in the vaccine and delivery system. This is where during COVID we took a large hit because there was tons of people who were just spreading misinformation about how the vaccines were rushed and all that kind of stuff. So this is actually, politicians have done a huge amount of damage in confidence. So this is called, when we refer to this, I refer to this as the 5 C's, but there's 3 C's that are negative and 2 C's that are positive. So trust is confidence in the system. This will manifest that in ways that you'll hear things like, well, they rushed the vaccine and they didn't actually listen to us, or they're trying to control us, or mind control, or all these kind of things. And this is where trust and confidence are certainly important. We have complacency, and this one actually, they actually have a perception that the risks are very low. And so they have other health and responsibilities that are higher priorities. This commonly happens also with like things like long-term out. So if they perceive that they've never heard of measles, you may be like, well, I'm not going to get the measles, or Gardasil, I'm not going to get that vaccine for HPV because I have very little chance of getting that. The other negative is structural. This is access availability. And if in their communities, it can become part of their identity to be an anti-vaxxer. That's when you have a really big concern. And you also know that motivational interviewing can also impact this as you deal with the cognitive dissonance. In other words, they're actually dealing with contrary evidence that they're both incorporating into their mind view. And so structural or psychological can have those effects. Structural can be simple as, hey, I can't get the vaccine because if my kid has any side effects, I can't miss work. Hey, Ricky. So those are the considerations. Those are the negative barrier. Those are the barriers. Some of the positive is engagement and extensive information gathering. Sometimes this can be a negative if they've been around talking to the wrong people, but generally speaking, most people this is a very big positive. And a collective response is, are they willing to help other people? I actually, in COVID years, I've actually I don't even, if I'm not going to engage anybody in collective mindset, it's just not worth your time. Most people will just focus on themselves. So, which is, is what it is. Question.
Yes. So what do you do for people who, I feel like as soon as they like COVID kind of like hit, not really hit, but like the vaccine came out and like people started opposing the COVID vaccine, a lot of people like shifted to completely being anti-vaxxers.
Yes.
And not to be specifically like regarding COVID, but I feel like a lot of people, as soon as like they don't agree with one vaccine, they immediately like encompass everything.
Yes.
So how do you kind of just stop them right there before they become completely, I guess, vaccine refusers?
Yeah. So the one, I'll just say right off the bat, the one thing that you should not engage people with is facts. Immediately, the first thing that I hear out of people is, well, you need to read this, or here's this pamphlet, or the actual thing that we'll talk about how to do this in the second hour. But the most important thing is you listen to their concerns. Oh, I'll go through, all the details. But generally speaking, what you're going to do is you're going to try to get them to process your experience and actual facts and process it against the anti-vax story that they're hearing, so they can actually put together the pieces of the puzzle themselves and overcome that negative information that they're hearing from all their communities that they live in. Generally speaking, this comes from community, and people are anti-vaxxers because of bias. Again, there are structural things like accessibility that's a concern, but generally speaking, that one's way easier to deal with than someone who's built in an anti-vaxxer into their core being. So ways to stop it is to have this motivational interviewing discussion, which is the topic of the full second hour, Antonella. So does that work to answer that?
Yes, it does. Sorry. Thank you.
No, you're fine. I really appreciate the fact that you're already going there, because that's exactly where the reason we're discussing all of these topics is because it's going to be important for you as you do the motivational interviewing to identify, okay, what am I talking about here? Am I talking about a denier, or am I talking about someone who's just worried about, the sick getting, or their kid getting, or themselves getting sick for a couple of days and not being able to miss work? I mean, how many of you had friends who got the COVID vaccine and they were knocked out for 3 days? Or you had that happen? And could you miss neural for a day because you had, because of, or could you, right? So these are the things that are really real in people's lives. And so though that one's very different than, hey, I'm an ultra right wing or ultra left wing. I'm a really strong health believer in organic and health versus, hey, I'm part of the really conservative community, the ultra conservatives that believe that this is my freedoms are being violated. You'll hear all those things. So first, the most important step is identify, and then we'll start getting into, again, we have religious reasons. This is actually community based, right? Like people often, there's not a religious tenet or doctrinal issue associated with vaccines. Sometimes there is, but most of the time it's just the religious community has adopted it as non-doctrine, part of their religious tenets, but more just a community standard. Personal and philosophical reasons. This is where you'll see people who are very concerned about their health, safety concerns. They've heard a lot of people or someone close to them has had an adverse event and they're concerned that it would happen to them. They need more information. This actually is a common way to, these are people who are commonly easily persuaded. And the lack of trust. This is the conspiracy theories, all the way ranging up to, hey, I just don't know if that vaccine is going to be right for me. But commonly these days, it's, Bill Gates is trying to inject me so they can track me, which I have people and friends who legitimately believe that Bill Gates is out to track their every move. So, all right, what doesn't work? We'll start with that. You tell them so the study's looking at web-based interventions that educate parents. You're not going to educate the parents and get them to change their mind. Social media tends to reinforce already held positions, and I'll show you this here in a minute. Some of the positions, and you probably have all experienced stuff like this, and I'll just talk about how I responded. So, used to be that we would have, if we had a vaccine preventable disease and we'd see someone show up to Disneyland and spread measles around to 100 people, that it would be effective, but recently that's not true. So these epidemics and news stories have not helped. So evidence-based is not persuasive to people who are vaccine hesitant. I cannot show you a brochure and have you be convinced that it's going to be effective. I'll reiterate this when we talk about motivational interviewing. So, and then you basically have to get people out of their echo chambers, which is not easy. This is still a good thing. And I don't know if this is 80% of people say their primary care provider is a positive influence. I'm a little concerned what the other 20% are doing. Hopefully that's not any of you, but truth is I'm actually pleased that it's 80 and not less. I hope it's still 80. The medical field is doing a good job there. This is a really good, different studies have found that 30 to 47% of vaccine hesitant parents agreed to vaccinate if they were engaged in discussions with their provider. I think this number is probably going down now, but the truth is that you can make a difference. That's the reason we put this in there. You can make a difference in how you do this. And if you hone your craft and hone your skills, it can be effective. I think with certain groups, you have to be really cognizant of mandatory vaccines. So, and we could talk probably all night about mandatory vaccines and what that means and what that looks like and how that influences things. But I think you need to be curious about how mandatory vaccines really come across. So I can tell you that they have not been positive for many of my peers or many of my colleagues. Okay, let's talk about some things that we do. We're starting to tilt into now some of the things that where we're going to start talking about how they work, but we'll dig into the nitty-gritty in the second hour. So first and foremost, you have to build from a place of connection and trust. You have to also assume that the parents want to do what's best for their child. You also have to work from a place of shared decision-making. Now, you can start off with the assumption that your kid, that the child is going to get the vaccine. I assume that your child's going to get the vaccine. You can just be, you don't have to say I assume. You can just be like, so you can just basically describe that with a presumption the parents are going to have the vaccine today. That works pretty well for a chunk of people. If there's any hesitancy, you deal with that with motivational interviewing. I'm not a huge fan of need to explain that the vaccines work, The reason that I have this slide is basically or this full slide is for this slide. I actually think that this is not persuasive to people. I mean, you as providers know that, but it is not effective to actually describe that. So I would actually encourage you not to explain in direct terms. I do like the idea of being presumptuous and saying, so little Joey, little Susie, little Preetha's, what they're going to be getting the vaccine today. Conversation should be non-confrontational. That doesn't mean you always do it, but if you feel that if you're reading the room correctly, this is a good approach. Conversation should be non-confrontational, and parents' concerns need to be acknowledged and addressed. Okay, providing with scientific data is probably not enough. You have to have a trusting relationship with the family in order for your message to be effective. Stories and personal examples are usually more effective than quoting statistics. One of the things in my motivational interviewing or my experience with SP that I thought was really helpful, one of the students talked about how his grandfather was in the hospital for 4 months with shingles. That's a great story to share. Sharing your personal story is also effective. We'll talk a little bit more. This is actually not true. Motivational interviewing has been studied. It is effective. And then this is one way to do it. Ask, acknowledge, advise. We'll go into a little more detail on that as we get going. One of the common things that you'll hear is vaccines overwhelm the immune system. We've talked about this in several classes before. The truth is that the number of vaccines we have done has gone up a lot, but it's still nowhere near how much, I don't know, I'm trying to get my pictures of you out of the way of my slide so I can. But the truth is that we've actually done a really good job of reducing some of these total proteins. And we've also done a really good job. And honestly, nature will give them a lot more than the vaccines will. Okay. Let me summarize a few things. Then we're going to go look at some stuff and we'll have a discussion on what kind of person we think on the spectrum of vaccine denial. What do we think some of these people are? Okay. Summary. First, important points. We have deniers, refusers, and hesitants. And it's super important that we appreciate that we're not going to convince a denier, and we probably are not going to get a refuser. And the main thrust of our conversations are going to be the hesitant individuals. Okay. Identifying the factors that go into vaccine hesitancy is important to pulling out in motivational interviewing. We talk about this because I want you to sit down and say, okay, this is a confidence issue. And it's not necessarily that you're really important that you label it like, oh no, that's not a confidence thing. This is a complacency issue. It's really important that you acknowledge what it is and start to see if you can pull out what that looks like in front of for the patient. Okay. We all have different motivations. Some of it's very entrenched, and that's when you have to be really good at the game. What doesn't work, web-based interventions, evidence, mandatory, all those things, we need to be non-confrontational. Okay. Do you have any questions? Okay, let's look at some examples. See if I can find my Facebook. So this is a feed, Megan. I'm really proud of Megan and Nicole. Nikki, they have been working on this HPV project already. I've talked to some of you about other projects, but this is one that I think is super important in my book, and I'm super excited about. So, has anyone got the Gardasil vaccine accidentally while pregnant Was supposed to get Tdap, but the nurse gave me the wrong vaccine. Looking to see if anyone else has similar experiences to my daughter and I. Thanks in advance. What do we think as far as what's the first step that we need to do here? Is this someone that's worthy of engagement? In real life or on social media?
I think that's a tricky question because it's like you don't want to invalidate their experience. Like that's horrible. But at the same time, it's just going to lead to like trash talking the nurse and then the system and healthcare.
You
So
really,
that's
yeah,
tough.
if you look at this, some of these people already started, right? It didn't even take them 2.5 seconds. So if we compare Mary's comments versus Kelly's comments, we can immediately see, I hope you have contacted an attorney, right? That's just a blatantly aggressive, that's probably a vaccine denier. If I'm reading that room, I'm like, that's a patient's right fundamental violation. Call your attorney. You know, and we got these people here who are loving it and liking that, right? So I actually did comment on this. And my comments, actually, I kind of want to hide them for a second. Don't look at my comments for a minute. Let's talk a little bit about I would not get a single vaccine pregnant. I would sue them for their mistake, right? Do you think that person's on, where are they on the spectrum of things? Nikki, I can
Probably
see you
just
moving your lips. So
I'm sorry, probably a refuser.
yeah, I would say refuser, maybe
Or
even a denier, right?
Yeah.
I think a solid, because they did qualify it a single vaccine while pregnant. They didn't say they would never get a vaccine ever, right? The flip side of that is what's the difference between a refuser and denier? A refuser stays within their own sphere, and she is using the third person, so that really kind of gives you the idea that okay, this person probably is, but they're also posting on social media, so we need to kind of balance all that out. And I would say they're in the spectrum of between refuser and denier. Is that are we going to convince that person? I don't know, right? That would be a person I'd be like, I'll engage and feel the room, read the room, and see where they are. Mary, here's how my interpretation of Mary was actually really open to getting a vaccine, right? So she's probably just on the hesitant. And this is the kind of person she was already open. We had a vaccine mistake, right? The nurse gave her the wrong vaccine. And so that person, that's where I would start to really engage more thoroughly or try to engage and see if you could pull that person into getting the vaccine. Thoughts?
I think it depends on their wait, are we talking about Mary or the
Yeah,
one who's
Mary.
oh, I think unfortunately that's a very common experience.
It is.
It's not hasn't happened to me, but I've seen it before. Like we were supposed to give someone a COVID shot and we gave them 2 flu shots. So they had 2 flu shots in one season. And the first thing we do is we monitor them, like you said, like your comment says, like, did they have any ill side effects? And we just track them to see, because not all the time are they going to have an adverse reaction. And I think just talking to her and then being like really remorseful, and then of course explaining how mistakes happen and it's unfortunate, but then still validating her feelings as a person and as a patient that it wasn't intentional, obviously. And again, like, how can we ramify it? Like, so how can we make up for it almost? But then still have her trust in the system. I think it's going to depend on who gave her the vaccine too.
Yes. Other thoughts?
I mean, my sister was given a vaccine by a trainee nurse and then asked later by the more senior nurses if she was given the right one. So she's been switched more from, accepting to hesitant because of a mistake. So I feel like Mary might be more hesitant now because of all of this.
Absolutely. This is why I'm, following these things up is super important to make sure things get done correctly. Yeah. So my comments, I made a comment here. Did you suffer any ill effects? Because that's actually the heart of the issue, right? Like, and it doesn't, I don't think she did, because she didn't even answer the question. Yeah. And actually she was more concerned that getting Tdap was normal. So this person actually really, really understands what is normal and considered. And then I just was apologetic and said, sorry with the confusion. I was really more talking with these people who are like, call an attorney and blah, blah, blah. And I really like to shut that kind of stuff down because one of the things that happens that people don't understand, they're always talking about suing this and suing that. And you'll get in this like crazy escalation of distracting arguments from the situation. So I generally just like to nip that in the bud and say, hey, if you didn't have any side effects, there's not really much of a lawsuit there, right? Like, so, and because people don't think about that, you have to be harmed in some way, right, in order for there to be a lawsuit. And then I just talk about, I just notice I don't confront anybody else. I'm not confrontational. I just state facts. Getting a vaccine while pregnant is common, especially for things like whooping cough. Both my daughters, I share a personal experience in there. Both my daughters did, and it was pretty normal. So
I think what's pretty cool about a situation like that too is depending on your relationship with the person or with the patient, it's actually a really great learning opportunity for patient autonomy. And you can really spin it around and like encourage the patient and encourage future patients to say, hey, like at the end of the day, your health you're in charge of your health, right? We are here to like guide you, and we make shared decision making, like you said earlier. But at the end of the day, you're the final say. So if you want to question, like up until the moment they stick you with that needle, like, hey, this is this vaccine, right? This is what we're getting. It has this XYZ, and that's totally okay. And any provider that has a sane mind and understands someone who has an experience like this will be okay with someone who's more inquisitive about their own healthcare.
Yes. And you'll note my comments are not necessarily to stop Kelly Parrott from, I'm not really interested in changing Kelly's mind, right? More than this Kaylee person, right? I'm curious how that happens. She's actually more, I think this person's more open. And if I look at Tammy, I'm so sorry that happened to you. Very empathetic person, right? Like, so these are the kind of people that I would be more interested in. OMG, medical battery. I mean, I don't know I don't know how to deal with that, honestly. I don't know how to process that. This one is also very, very interesting to me. I really, really like this conversation here. Actually, I'm only here looking for information because I know that I cannot be the only one going through this. I'm not here to start a debate. I know, so this is off to a good start, right? We have the right tone. We're more interested in advocating for their son versus dealing with, let's start a flaming, echo chamber. My son went for a 16-year-old checkup, received the HPV and meningitis vaccine. The first day, his arm was restored. Next day, it burned. And then it went away. He has no feeling in his arm after receiving the vaccine. He can move it, but he's losing some muscle mass because of it. We've been through neurologists. They did a CT scan of his head and his arm. Everything came back normal, but he still has no feeling. We've been doing physical therapy for 3 weeks. Anyway, go through. They do have a lawyer involved, but I've talked to the CDC and the FDA, and they just they asked them just if they could give me any information, since no one knows or seen anything like this. And so this is not an uncommon adverse event. So she's actually feeling like they're not listening to her, or she's not listening to what they're saying, right? Because this is a neurological side effect. And this is where this is a person we could actually, I think, interface with, because all she wants is she wants to actually help, right? This person is not an acti. And if we can actually help this person, then this is the type of person that does not become an anti-vaxxer. Her last question is, does anyone have any advice? So, and she gives some pictures, and actually they're pretty, I consider them pretty, you know. So impactful for me. So Kaylee, the one from above who seemed pretty reasonable, you can report to VAERS. I was injured by this vaccine the second I got it. Now bedridden and unable to work or even make food for myself. I'm 3 months and I've already been diagnosed with SVT tachycardia and POTS. The only thing you can do is just detox them at this point. Now, so this is a common anti-vax line, detox from the vaccine. That's not a thing. There's no biochemistry and no immunology that supports detox. That's somebody's idea of, because the immune system doesn't detox. Your liver does a great job of detoxing. You all know that better than I do. So, but how do we talk to her about this? Look up heavy metal detox. No one has any heavy metals in the vaccine. So we went and studied that in components. So do we just go rush at her and say, we don't have any heavy metals in there? That's factually incorrect. And we just lambast her? How do we handle this person?
You could ask them which metals they are afraid are in the vaccine potentially, right?
Well, I think then you're still arguing components, right? So that would be one way of doing it. I would actually get to what she's actually really concerned about first and foremost. And for her, she actually wants to acknowledge that POTS and SVT tachycardia can be an adverse event associated with the vaccine. And they can be. That's the first way most medical professionals will not acknowledge that these are events. You hear that up here from Becca when she says, I've talked to the CDC and the FDA and asked them if they could give me any information since no one has seen anything like this. This is not this is a neurological, right? This is neurological. There's tons of neurological side effects. So that's where I would focus. Chris, what do you think about that?
I totally agree. So in this, would you give them like a link to like the adverse vaccine reporting system?
I think we do. No, I would actually tell her, I'm going to report this to the VAERS and put it in the system for you. I'll put in all the effects. Is there anything you'd like me to add? That's where I would start. Then I would talk about, okay, acknowledging the fact that there's an adverse event that POTS is also a very common adverse event. It's basically a, for lack of a better term, a pot of symptoms that it's a grab bag, right? And so and it's not really a firm diagnosis. It's kind of like a hodgepodge of things. And so, but we do need to acknowledge it. That's the first thing to building connection with the students, is acknowledging that this is, or with the patient, this is something that is likely caused by the vaccine. And they are unfortunately the recipient of that. And and the next thing you need to do is talk about what it looks like to fix the problem. Thoughts on that? I actually am a little bit annoyed with my response here. I said he will recover, and because most people who have these kind of situations, neurological conditions, recover. I shouldn't be so definitive. You should report to VAERS. It will likely require physical therapy. You should talk to your healthcare provider about GBS. This is neurologically likely autoimmune mediated. And she was actually Kaylee Stockton, the one who was up here, who was semi anti-vaxxer, really liked that. What could I have done better here?
I'm thinking maybe if you kind of like acknowledged like the pain, I guess, and like the kind of
Yep.
like what they're going through, and like maybe like apologize for the situation, and then
Yes.
like gone into like he'll get better though, kind of like preface it first.
Yep. That would have been a better response on my part. I agree. Other
Yeah, I
thoughts?
think like you were saying, meeting them where they're at is like a very important part for including them in a conversation as opposed to them like attacking you immediately.
No one attacked me on this, right? That should be your goal, and we should have positive responses. So I had a little bit of a positive response, but I did not have as positive a response as potentially, right? I could have done better there, and so that's that's this process, right? But I used to go and with flamethrowers, with evidence, and you can ask my wife that I was a Facebook warrior, and I'd come back shooting bullets and flames everywhere, and that's exactly the opposite approach we want to take here. We need to empathize, talk with the patient. You need to acknowledge that this is a risk. You don't have to acknowledge that it is the cause, with acknowledging that it is a common reaction. Notice what the difference and the subtlety that's super important. If someone comes back and says, I grew a third arm because of the vaccine, that's not a real thing, right? So you can in that situation, you're probably not going to connect with that person. But if they have some of these anything neurological is a very, very, very common side effect. Tinnitus, with ringing in the ears, GBS, Bell's palsy, autoimmune inflammation, SLE. All these things are when I say common adverse event, what do I mean by common adverse event?
That it's been seen before.
It's
Maybe
been
not
seen
necessarily.
before. It doesn't mean that if there's 1,000 people who get the vaccine, a common does not mean that they're going to 500 people are going to have it, right? What I'm saying for is when we have adverse events, this is something we see when we see adverse events, not that it is common with the vaccine. You need to be very careful in your wording when you say that. What you say is, we do see this, and you actually assess the 100,000 people have this event. I'm really sorry that it happened to you. Because, Ryan actually does a really good job. Majority of people on this group are injured or have children injured. You're not crazy, right? So that's actually a very positive response. Let's look at one more. Let's see. So glad I found this group. I feel so alone in this journey. I'm 41 years old. I had no reaction from the first shot taken last year. I got a second shot within 7 days. I was working gradually and my legs started getting weaker. Again, this is a neurological situation, right? It's related to GBS. We have an autoimmune mediated attack that's giving nerve damage. Went to 2 chiropractors. They wouldn't touch it and said it's neuro. Went to the hospital and the head of neurosurgery said they can't find anything. That's because you need to go to a rheumatologist, right? Like my first advice to them is, and this person actually, Alarni Clark does a good job. She talks right down here at the bottom, GBS syndrome after Gardasil vaccination, right? That report. Okay, it took me 3 months to be able to start getting, and this happens. This happens. You will see this on the interweb a lot in these vaccine groups. In fact, there's 2 in the Shingrix group. Actually, 2, maybe 3. I haven't talked. We're interviewing somebody on Thursday. And so now I have tremors some days really bad, like Parkinson's. Neuro already ruled that out. That's because this is an autoimmune mediated GBS associated issue. I'm now tachycardic now. I'm having trouble with my words and names. I have balance issues. All these things are neurological, right? Of sense of smell and taste at one point. I have a bad eye twitch. How many of you agree with me this is all neurological? Now that you're in neuro, right? This is very common in groups like this. And I think I haven't commented on this one, and actually I've been kind of debating. I don't think I've commented on this one. But I think I actually need to sit down and think about what I would say here. I agree with Larney. this is a GBS issue. And actually, I would really like to, at some point, recreate this. This was actually done in Australia, and I'd like to recreate it using bears. One thing I really want to emphasize out of this, then we'll take a quick break before we get into motivational interviewing. Out of that situation is a lot of times this is misdiagnosed. Who is the first person you should send this to? If I'm channeling IHL for you, like give you a clue, you should be sending cases like this to first and foremost a rheumatologist, because they're gonna start to identify autoimmune disease. You could do a neurologist as well, but the honest goodness truth is a neurologist is gonna think what? Parkinson's, just like they did. You're not gonna get Parkinson's after 8 weeks after a vaccine at 41 years old, right? So you have to be really good at diagnosing these kind of things and start to understand what specialty you need to look at. So as a physician in this situation, you look at VAERS and then you refer to the rheumatologist or the neurologist, and you own this patient if you're a family med doc, right? Or a general. Thoughts? How would you handle the Facebook post here?
I feel like you could do it pretty similar to how you did the other post, and then just add it with the boy, and then just add in the like, sorry, this happened to you. Like, this is a pretty common adverse reaction. And then they included some resources, which is good too. Not that that's like the most persuasive thing, but
well, but I think what it did in this situation, the evidence actually was validating for them. So it is, I really like that. And I should actually qualify that, Nikki. You're absolutely right. This evidence validates their worldview. So if you have evidence that's validating, you absolutely can use it, right?
okay,
Don't
so
go
it's
at
just
them.
like handing a brochure is like where you don't want to use evidence.
Yes.
And I think, okay.
And that sounds counterintuitive. Like, don't try to convince them with evidence, right? But this is validating to them. Like, this does happen to people, and you're not alone. And you can validate that we're here to help you, not to judge you or do any of those kind of things. Like, invalidate their experience, because seriously, this happens to people. If you spend 15 minutes on these websites, you will see that this does happen. And we know it happens because I can tell you I mine bears all the time. I'm in bears all the time. A healthy 41-year-old woman does not develop neurological symptoms out of nowhere. What are the causes? Stroke. Is it possible she had a stroke? Possible, but not likely. Because why? Because neurology ruled it out, right? They probably did a head CT. So they probably ruled it out. Tremors like Parkinson's. So I think that you immediately can go to rheumatology. Does this mean we actually have a faculty or a staff member who did? I'm going to stop for a second. I'm just going to chat a little bit. We have a staff member who we did a grand rounds, which you'll go through in your third year with me. We had a faculty member they did a grand rounds on, who got the COVID vaccine, and she developed lupus, transient form of lupus out of it. And she had all kinds of rashes and all kinds of other effects. And she immediately went to all of us and started talking about what was going on. And I don't know what people would do without having that kind of resources for us to kind of like put our brains together and come up with these kind of solutions. Rheumatologists, I think, have one of the most challenging jobs on the planet. I think if I was actually going to be a doc, that would be amongst my top of the list, would be a rheumatologist. because I think there's a lot of puzzles that when you solve the puzzle, you're helping people. So hopefully you're getting an idea of some of the things that can happen, how to interface with patients, because you're probably not going to have the patient that's going to come in and say, well, my son got a vaccine injury, so I'm not getting vaccinated. Are you going to convince that person? Probably not. What story are you going to hear? From people, if they're going to tell you a story. There's a guy down the street who got the vaccine. Like my son knows somebody who, right? And things like that are, well, you have to put that in risk assessment. So your first job is connect. We'll talk about that, what that means here in a minute. But first job is to connect with your patient and hear what they have to say. And your question is, are you concerned that's going to happen to you? Let them hear what they have to say, and then you're going to respond back to them. So what I hear you saying is that you are concerned that this is going to happen to you. Yes. And then you might do something like, my understanding of the risk, I've been doing this a long time, is we get this vaccine a lot. We don't often see that. In fact, as a provider, I've never seen that happen. Would that change your perspective that this is a very rare event? Ask them that question. And then we build from there. We'll talk about how that looks like in the next. I'm getting a little bit ahead of myself. So let's take 5-10 minutes and we'll come back. Let's start back up at 7:05. And we'll dive into we'll start really getting into what this looks like and how to deal with it. Sound like a plan? Cool. I'm going to share my screen here. This is a misadministration of a vaccine, right? I don't know what the child is grimacing for, but these things happen. Okay, let's go back into there we go. Okay. Can you, why is it? Did you see my screen? What I was doing?
We can see it now.
Okay, we better. Can you see motivational interviewing and vaccine hesitancy? Okay, good. All right, so let's talk a little bit about, this is the application that we're looking for, right? So this is actually what we want to accomplish, or this is the technique we want to use to get the patient feeling comfortable and discussing the topic with us. So in the first lecture, we started to tease this a little bit. We're going to dive in. We also talked about who we should be talking to and fundamentally how to identify their deep down concerns. That's going to be super important as we get into this. So here's some of the learning objectives. We definitely want to recognize determinants, talk a little bit more about that. Principles, we're going to reiterate some of the points. Principles of motivation interviewing, skills needed, reflective listening, how to get change talk, identifying change talk, and then applying it back in the conversation, and then negotiating an action plan. You'll notice that these are the 3 major steps associated with motivational interviewing. Here's kind of a review. A definition can be a delay in acceptance or refusal of a vaccine despite available vaccine services. Again, complex, context sensitive, can have all kinds of factors. notice that they use the 3 C's as well when they apply that. The vaccine hesitant individual, as we might recall, is the person that's kind of in the middle of the spectrum from accepting vaccines all the way to denier. They're in the middle. And so there's some really, really key points. Then I think that this does a really good job of summarizing previous experience with vaccines and vaccine-related diseases. They commonly just have minor misinformation and informational gaps, not misinformation, right? There might be some small social views or religious views, and they may be on the, if they're hesitant, they may be on the periphery of these groups, and so they're influenced but not converted, for lack of a better term. So, and interfacing with healthcare professionals can really make a huge difference in this group. So motivational interviewing, I think all of you have been exposed to it, but we've been exposed to it in the context of some chronic conditions like diabetes management, and trying to ensure that the patient adheres to medication or treatment plans or diagnostic schedules and those kind of things. This actually, what we're trying to do is a form of evidence-based counseling, and the idea is to facilitate a change in attitude towards vaccines. It is patient-centered, and so style. And really what we're going to do is explore the patient feelings, and kind of through those discussions, you're trying to resolve their ambivalence that will result in a behavior change. So it can, and it has been proven to work in substance abuse, chronic condition treatment, so things like diabetes, and it's especially helpful when there was a noted difference in culture between the patient and the clinician. So ambivalence is you're having mixed feelings. The evidence that presents itself to you is not in line with a value or a feeling that you have, or vice versa. You may need to dive, actually not may, you will need to dive deeper on the emotions and why they feel this way. The goal is to understand why the change is needed, what the person thinks about the issue, and start to talk with them about how to get this actually improve vaccine uptake. Okay, that's the goal. Why does it work? Okay, you're not trying to change their mind. This is a concept of self-exploration, and you are the guide. So kind of think of like yourself as a counselor, and you're just exploring the feelings they have and how you're going to get to the point where you can make substantive changes based on overcoming ambivalence in the patient. You do not want to engage in argumentative dialogue. You don't want to interrupt while they're doing this. So, and what you're trying to do is interrupt this groupthink mentality that's occurred. So, one of the reasons why we don't want to engage in argumentative dialogue is people tend to rely on their behaviors, their past behaviors, and then they'll engage in circular reasoning and fallacies to reinforce them. You've probably all experienced this. In fact, you've probably done it yourself, where you go from A to B and B to A, and then that's where you're living, So, and that helps reinforce this really well. And the goal is you're trying to take the information and get in between that circular logic and break it up a little bit. Again, here's one. If A is true, B is true. If B is true, A is true. That's kind of circular logic that they're going to engage in. The other thing that can happen is you can get polarization. And we talked about this a little bit last time, where if we talked about something like abortion or some of these other really polar topics, and vaccines now fall in this category, you are going to, if I talk to someone about being a vegetarian, or, people have very strong opinions on that, right? And often these are nuanced arguments, and the truth lies somewhere in the middle. But because we talk about them in such a way, they end up polarizing them, and there's no middle ground, no opportunity to bridge the gap And really, we make changes in small steps, incremental steps. We don't often see people just go, oh yeah, here's a piece of evidence. I'm going to switch from one side of the spectrum all the way to the other. I'm going to go from pro-life to pro-choice, or I'm going from pro-choice to pro-life. We don't see that with these kind of things. So we really, what our goal is to move the needle step by step. So, and what we commonly see it because of this is cognitive inflexibility. It's ingrained in who they are, and you'll see this with religious entity, organizations. Religious entity can do a lot of positive things, but they also can ingrain some really questionable behaviors where your identity is mixed up in it, and you cannot disassociate from things that are associated with this doesn't necessarily have to be religious. This can be anything from, you can be fanatical and have cognitive inflexibility about the Green Bay Packers, right? Like I'm rigidly, even though they may do something that you find unethical or immoral, you're still going to back them regardless because you are cognitively inflexible. So you see that I use religion as an example because it's probably one we mostly can relate with, but you can see this in all different kinds of spectrums, and it doesn't necessarily mean religious groups have this. It just means it's an example of one. So this can happen, and I'm more reflecting on people who are in cults or things that are extreme, very extreme, where you're just like, I don't know how in the world they could believe that the Earth was going to end in 2012, right? Like it's normally not possible for you to comprehend, right? So that's cognitive inflexibility. So, and what the trick here is, as we're doing this, we absolutely want to be able to get them to take a step out of their circular reasoning, out of their cognitive inflexibility, out of their polarization, out of the rigid cognitive specialization, and step out of that and take a look from the other side and see what they see and associate it with facts and feelings that the other side may feel, and see if and feelings they may themselves even feel, and see if they can get a small step towards doing that, towards changing their mind. Your job is to be a director of the exploration in that process. Look at their values about vaccines and see if they can actually bridge the gap that exists. You're going to be going from, in the steps of a theoretical model of health behavior change, you're going to be going from pre-contemplation, and that we see this pre-contemplation before they've thought about some of the issues, and then we're going to go into contemplation. So this pre-contemplation is they're pretty unaware of what's going on, or they're really unaware of some evidence, or they're really unaware of feelings that they've had, and your job as the healthcare provider is to kind of walk them through. Now, if you're sitting here thinking, wow, this could take a long time, what concerns do you have with that?
I mean, they could be exposed to whatever we're trying to vaccinate them against before we even have a chance to get them to agree to taking it.
Yes, Emily, I love the fact that you said that first, because most people would say, I'm not going to have enough time to talk with that patient, right? So you're still even focused on the issue, which is really good. Most people are like, I have 15 minutes to discuss this with patients. How am I going to get them all the way through this cycle? And that is a real concern. So sometimes as you're doing this, and your concern is real too, like, because what? This is going to take multiple episodes, right? Commonly. And so they may be exposed to the disease, or they're going to be exposed to the negative influences in their lives. So those things are really real. Your job is to get them contemplating, be aware of the pros and cons of the behavior, and try to initiate some ideas of pro-health behaviors. So, and what we're going to do is we're going to talk about preparation, action. Preparation is the stage at which we are going to see if we can get them to contemplate change, right? That's going to lead, and we'll plan after that, and then we'll talk about taking action. And then this is where maintenance comes in, and this is where we're going to see, okay, you're going to come back for the next shot, right? And we could go into a relapse, right? So every year you have to get the flu shot, right? So you may have to revisit this whole thing all over again because they're exposed to all the anti-vax stories again and again and again in their communities. their various communities, and your job is you have to get them to think about it again, prepare, get them cognitively thinking about stuff, take action, and then maintain it over the long term. So those are 7. And this one is not as in depth as it could be when we're talking about something like diabetes, but vaccines are going to be a lifelong discussion point. So your job is to be a counselor. Listen, instruct. You're going to acknowledge their feelings and their information. Doesn't mean you're going to validate it. You're going to acknowledge it. Huge difference, right? You're also going to acknowledge their dissonance. Dissonance is a difference between the facts that you present them or the feelings they have and outside information, right? Outside feelings, and I say feelings because things like my anecdotal story is not evidence. That's a feeling you're generating in them. So you can generate contrary evidence and feelings in them to themselves, and you're going to first acknowledge them, and then you're going to identify how to get them to recognize that they have dissonance between those two things and see where you go with them. And you're going to invite them to talk about it because that's the way you're going to make difference. Okay, important concepts of motivational interviewing: partnership, collaboration, sharing the power and the knowledge, right? This is you're making a group decision here. You acknowledge the goal that you have is their health. That's what they want for obvious reasons, right? That doesn't always mean they act in their own best interest, but if you really dive deep, you will find that most people are trying to do the right thing. They need help doing the right thing. And so you are their partner. The partner the patient has autonomy, right? They're the one who ultimately gets to make the decision for their own health. Okay, your job is a guide. You can be empathetic, help them reflect on the issue. You reflect on the issue. You're going to be judgment-free, and you're going to give them the counterbalancing arguments. You can convince people much more effectively if instead of like trying to throw the polar opposite of the argument, if they're here and you throw the polar argument, if I say I'm against abortion, everyone should have access to abortion, you're being like, no, I'm going to ban abortion. There's such a broad gap here that it's very difficult to bridge. What you do is you try to meet them in the middle, which is where most people end up, right? And I'm using abortion, and hopefully you're not gauging what my abortion position is, because honestly, I don't even know if I know what my abortion is. I'm just using it as an issue that I actually change my mind quite frequently about abortion, because I don't think it's I don't think the polar place is actually a place where I feel comfortable. I don't feel comfortable, and I think the individual actually has should have a lot of say in what's going on. But I don't know that that's completely true. So I don't know. This gives me a lot of dissonance, right? So maybe someone needs to motivational interview me on this topic, right?
I think that's the logical fallacy of the false dilemma, is that a lot of society presents, you have option A or option B, but a lot of times there's options A through Z. And it's like the political conversation loves to talk about this. It's like you're either a vaxxer, you're an anti-vaxxer, you're either pro-abortion, you're pro-life, you're either pro-guns, pro-anti-gun. And it's like even our democratic system, like our political system of like Republican, Democratic, it's like, well, there's a whole slew, and there's even other parties too. So logical fallacies.
I completely agree, Emily. It is a false dichotomy or false dilemma. Yes. And we're really good at putting those people in that, right? You absolutely need to focus on the client's well-being and their needs. Now, how do you do that? You're going to evoke about what their opinion is. You're going to present a feeling, an anecdotal story, or your experience. You're going to try to build a common ground, and you're going to try to get them to explore and discuss. You use a lot of questions. What are your concerns here? What are your goals? And what are you doing to, if you got a vaccine preventable disease, what would you do with it? Things that kind of get them thinking about why vaccines are important and how they're processing that dissonance that they're feeling as they kind of go through this. Oops. Skip the slide here. Okay. This is there's a little acronym rule, okay? Resist the writing reflex. Don't correct them, dismiss them, or tell them how they should feel or how they feel. This is I'm going to give you evidence, right? That is the writing reflex. They present opinion E, or opinion A, you're going to go to Z, right? I'm going to fix this. I'm going to go to the extremes. We definitely don't want to do that. We want to ask them, can you explain to me why you feel that way? Understand internal and external motivations. This goes back to the 3 C's that we talked about earlier, and they actually mentioned in the first slide. You know, we need to understand why. Is this structural? Are they part of a community? Is this part of their identity? Are they just complacent? What's going on, and what's your motivation to them? Listen for specific change talk. So we've identified them. We've asked a lot of questions in the process. And we say, hey, look, do you have it? I mean, during that process, you're looking for, in their brain, they will start talking about, I want to change. I'm capable of change. If I make this change, I will have positive results. If I don't change, I want to vaccinate my child, right? But I'm scared. Those kind of things, you're looking for change talk. That is a sign that the barriers are coming down. And your job from there is to empower the patient through participation and shared decision-making to kind of overcome those barriers. You're going to ask them questions. But if you want to change, what's preventing you from changing? And they might say, well, I can't get down here. I'm scared of missing work. Well, how could we schedule a time maybe? Would that be effective in helping you? I do this all the time with students. Like, I'm much better at telling students or motivational interviewing students. Good thing Carson's not here. And Chris, because my story would be leaked badly. I guess, Amin, you and Chris have to keep your mouth shut on how I discuss things with students, okay? Some of our old MSBS students.
What happened? What did we do?
Well, I used to motivational interview you all the time.
Yeah. Hey, I'm here. So
right?
That's almost a me right now too. Yeah.
Oh, hey. Yeah, so I used to do this all the time with students to get them to change their behaviors, their study habits. Well, what are you scared of? Not passing the test? Tell me how that would make you feel if we, so this is how we empower the students to make these changes after we talk about, and after they've started you're looking for a change talk. That's a huge key. I want to change. Okay. Ask them about what their goals are, their barriers are, and what they think the solutions are. And this is very interesting in terms of vaccines, because barriers are commonly just going to be informational. The goals are obviously going to be really straightforward. I don't want to get polio. I don't want my child to get polio, right? And solutions, if there isn't a solution that presents itself, or there actually won't be a solution that presents itself, that's not going to be vaccine related, right? So that's the nice part about doing this. Avoid giving advice without permission and demanding behavioral changes. These are things that are super important as you're discussing about the patient beliefs. Getting into the patient beliefs is important for understanding their motivations, right? We talked about it earlier. Asking patients about the beliefs is certainly important about that. How do we get to these points? Okay, so the basic skills are ORs. Okay, we ask open-ended question. Use the patient's own words. So what I'm hearing you say is this. What concerns do you have? So what I hear you're saying is this. Is that true? What barriers are existing that would prevent you from doing that? What motivations, what feelings, what information? And then you could ask them a question like, well, if you did change, what would be the outcomes that you would perceive happening? Right? These are questions that get them to internally process. How would you feel if you didn't get the vaccine? And you were exposed? Or how would you feel if you didn't get the vaccine and your child was exposed? Those things are certainly questions that then we put, anytime you see something that suggests that there's a positive on the horizon, you are going to affirm that. So what I heard you say was this. I really appreciate that, because that's what we see going on as well. We set up reflective listening. We set up goals, We limit our interruptions, and this is going to be really, really hard to do. About 2/3 to 3/4 of your session should be focused on the patient and you're listening. And most of the interview will be questions you're asking them to help them get through to the barriers and identify the barriers and how they're processing the feelings and information they're listening to. Let me see what I understand what you based on what you've told me so far. Is there anything that you would like to correct or add in what I'm hearing from you? These are interviewing questions that you can do. You do need to sit down and identify what the agenda for the patient is. If they're concerned about vaccine schedules, if they're concerned about adverse events, if they're concerned, they might be really thrilled about the benefits, but they may be balancing them against the potential for adverse events. They may also simply be not informed on what the vaccine is. They may not be informed. This is where the earlier part of the class is beneficial. So you can actually tell them, okay, this is actually what's in a vaccine. So we need to match their agenda word for word. And our job isn't to persuade them. If they're talking about components of vaccine, you're talking about components of vaccine. You're talking about the feelings associated with that. You're talking about the feelings associated with that as well. So we need to be evoking emotions. And we need to talking about, in particular, we need to be talking about how important it is to them and how confident they are in those decisions. Those two things are critical. So what I hear you saying is that you're concerned about infertility. How important is that to you? Oh, it's very important to me. Well, how sure are you that that's going to be a problem? Have you heard of other people having that issue as well? You know, and you can get to the source of what's going on. When you start hearing that, they start talking, well, maybe I should consider doing this, or I really kind of want to get the vaccine, but I'm still scared. Ask for what you're scared of, elaborate on examples, give them examples back to them. You know, I've had the vaccine myself. I haven't experienced this at all. That's actually poorly worded, but I have not experienced this. In my experience, I haven't seen this. We've given this vaccine for, over 10 years now. We very rarely, in fact, I could probably count on the hands in the past 10 years we've had issues with that. How do you feel about that? Does that, how does that make you feel as far as your risk? When they talk about it, affirm if they're positive. Okay. And you can say, I can understand where you're coming from. Being a dad myself, the number one concern I have is with my patient or with my family. So I absolutely hear you when you talk about, so we're responding with reflections. I'm reflecting on that. And if I heard that information, I'd probably want to look that information up as well. And I have looked that information up. And don't then try to preach at them. Just be like, well, I understand that's your concern. What can we do? What do you feel like would help you make a good decision?
I had a quick question, Dr. Brooks.
Yeah.
So a lot of hesitancy towards getting vaccines that I get asked a bunch is like, for instance, okay, my cousin got the vaccine and they had this reaction, or my friend got this vaccine and they had this reaction. So that's mainly the kind of questioning I get, like how to approach patients that have those kinds of questions.
Yeah. So first of all, you have to build a connection. You have to build a trust. Okay. So you're going to have, I think one of the things and you are going to have to do it faster than I do it, because what I do is I sit down and I think I've talked about this before. When I get on with a potential on the vaccine groups, when I get on and start talking with them, I'll talk a half an hour or as long as they want about whatever topic they're interested in. Right. So you have to build that connection. Hey, tell me about your family. How's your family doing? Blah, blah, blah. Okay. So let's talk about vaccines. Today I advise you to get the following vaccines. Oh, no, my cousin got this vaccine and his leg fell off, right? So, okay. Oh, wow, that sounds really horrible. Can you tell me a little more about that? Yeah, okay. So we've been given this vaccine here at this clinic for over 10 years. I'm not familiar with that, but I'm sure, and you would validate the experience. I'm sure that, that's a thing. That's poor wording, but you would say something to that effect, like invalidate them and say, yeah, it's a lot easier to actually do it with a real patient because you're having a real conversation, not a conversation in my brain. But you would say something like that and validate their feelings. Tell me what you think your actual risk of that happening is. Tell me what you think, how reasonable do you, or how do you feel like that would potentially happen? based on my experience, I don't see that. I've never seen that happen. So it seems like a pretty rare event that would happen. What are your concerns with that? Does that make sense,
No,
Sean?
no, that's super helpful. Thank you, Dr. Ricks.
So then what we're talking about, then we got to go through the other parts of the process. But that's how you get to that point. And you're going to actually have them look at what you see versus the one time that their family member had that issue. And you're going to see if you can bridge the gap between and have those discussions.
Yeah, it's kind of hard to back up your points without like statistical evidence, right? Like I can't pull up a CDC article and be like, oh, look, there's this many people that had so-and-so reaction to this drug. Or
doctors, you're going to so evidence-based medicine has the tripod of, right? We talk about evidence, right? We talk about patient values, and we talk about your authority. That's a bad word, but your presence as a healthcare provider. Instead of going to the evidence, go to your experience as a healthcare provider. That's real to them. They know you. You've developed a connection and a trust with them. So that's where you go and you see if you can create dissonance between what happened to their cousin and what your experience is, and see that they're going to have to balance your trust, right, versus their experience.
Yes.
And they'll have to sit there and you're going to just ask them questions. So what I'm hearing is you still have concerns, but I'm hearing that you trust that I have your best interest at heart.
Yeah.
Right?
Yeah, that's a really good approach. I actually like that.
So what I hear is this: let them process that and talk and discuss that and see what they say. The hard part here is I'm really truncating what the patient is going to say to you. For the most part, the patient's going to give you 30 seconds to a minute of discussion at that point, because they're trying to talk through their emotions. And that gives you plenty of time to sit back and say, and it doesn't mean that you're not going to screw that up. It does not mean you're going to screw it up. But the thing that you're going to have to get deep down inside of you is you're going to want to make sure that you don't give them the impression that your only goal is to give them the vaccine. Your goal, and it has to come through at every step, is I have your best interest at heart. This is your decision to make. You have the autonomy to make it. My job is to help you, guide you along the way. And you can even tell them that, hey, look, directly, like, I'm not going to make you get the vaccine. I think this is your decision to make. My job as a medical provider is to be your trusted ally. I have your best interest at heart, just like I know you have your best interest at heart, and I'll talk you through things. And if you have questions, I can answer them, and we'll process things, my experience and your experience, and we'll see what works out best for you.
Yeah, sounds good to me.
Well, here's the hard part. Every patient is different. I'll say that again. Every patient is different. Every conversation is different as you do this. And the truth is you're going to face this all the way through, but you're going to get really good at it, because it may not be vaccines, but it's going to be diabetes care. It's going to be, can I get a change in behavior? Can I get someone to use a prescription, stop abusing a prescription drug? Can I get people to, eat more healthy? Can I healthily? All those kind of things. And those kind of things are super valuable. Here, we're just using it in a very specific environment. I love this cartoon. And the truth is that it's very true. How do you convince someone? Look, we just wanted to avoid an argument, right? It's way better to avoid an argument and walk out not convinced than to get in an argument and lose the battle completely. I should say lose the war completely. It's better to come across and have kind of a truce where they haven't made a decision. Do not get argumentative with people. Okay, rolling with it. Our job is to build confidence in you and trust. I really appreciate the fact that you've done a lot of research. That shows that you are really engaged in doing a better job for your health. I really want, I really want to try to start taking my medication again. So what I'm hearing is, taking your medication is super important to you. Can you elaborate on that? Can you tell me more about why that's important to you? You can even exaggerate key points to encourage them that are positive. Do not over-exaggerate negative points. That's a huge no-no. Do not get into sarcasm or judgment or mockery. I'll tell you, your body language, controlling your body language is probably one of the hardest things that you're going to have to do in this. I would seriously invest time in just maintaining a strict poker face. Because I can tell you most of you are horrible at it. At least initially. You're like, really? Wow, that's something, right? Like, and I have to work at it too, because honestly, you probably have gathered from me. I have the biggest eyebrows ever. I'm like, whoa, a lot of times. Patient, I'm only here because my girlfriend made me. And then you say, that's the only reason you're here? We can actually be like, you see, that doesn't seem like that's true, because I think you care about your health, right? I mean, so you can actually get them to reflect and kind of make it more important. And then like double-sided reflections here. One side, I don't want to get the vaccine because of the side effects, but I also do want to get, and you can actually plant this in their brain if you would like. You can see what I'm hearing is you're concerned about the adverse events associated, potential adverse events associated with the vaccine, but you really would like the benefits of getting the vaccine in case you are exposed to polio, which obviously would be, not optimal. And if they can, that's a step in bridging, right? That's where we take, instead of being polarized, you're actually bridging, you're identifying, hey, you know what? These are the two issues that I have to do. I have to actually come together and actually make a decision on that. Build rapport, focus upon the target behavior in this situation, getting vaccines, look at internal motivations, reinforce positive ones, create dissonance. And then this is the optional step. So we've talked a lot about that. The optional step is planning. And this can be like getting a commitment out of them. You may read the room and be like, I'm not going to get a commitment out of them. You could be like, so unless they give me some really positive self-talk or positive talk, I'm not going to, or get in, like, man, I really would like to consider doing this. Unless you hear something, along those lines, you can just be like, hey, you know what? Let's give it some time to think about it. Our next meeting is in, 3 months. Does that give you enough time to kind of process? And maybe in the meantime, you can ask me questions that you have, and maybe I can help you decide what the best decision for you is. Notice I didn't say get the vaccine. I can help you make the best decision for you. Here's a great little acronym. Planning for action, 2 phases. Desire to change, you're looking for that. Ability to change, that's actually really simple with the vaccine. Reasons to change and need to change. So you're going to have to set the stage for all of these or some of these. And then you're going to have to try to get the commitment, the activation. Now, this should not be very apparent. You need to be very, very, let the patient be autonomous in this commitment. Let it come from them. So, okay. Reflect on what the patient is saying or implying to get the obstacles, all of these things. And questions you're going to ask is how, when, where, and you're going to focus on giving them autonomy and support in their action reflections. So basically what you're saying is, I'm reflecting on this. How do I get this? And action is an important part of that as we get going. So here's some other good steps in this process, steps getting and evoking. Does anyone have any questions about this? About how we're doing things so far? I feel like I'm being a little redundant here, so I'm going to kind of wrap it up, but I'd love to hear any comments or questions people have. Experiences. When you're reflecting upon your SP, how would you do things differently? I'll ask that question. How many of you felt like you did a good job now that we've talked about motivational interviewing with your SP?
I don't think I've done a good job. But I started the argument with them, and then the argument never stopped. So
You started an argument, you mean? I don't believe it.
it's kind of like, it's like, no, I'm not taking the vaccine. I'm like, why not? Like, with that from there,
So what would be a good approach if someone says I'm not taking the vaccine?
I'm like, I guess you're not ready today based on the conversation, like based on what you taught us today. I would say, I guess you're not today. Maybe you could talk about it in another day if you ever think that you need it. But just like,
What else?
and I guess encourage like I tell them like the benefit about it, but they just make the anatomy for them.
I want you to take a step back, right? We don't want to encourage them. What do we want to do? We wanted to say that we have, what's the first step in this?
Not sure. No.
That's okay.
To assess where they are in the
Yeah, we need
like,
to assess. Well, actually, the first step is we need to build a connection. We need to
Connection.
establish trust. Then we need to evaluate where they are, and how do we get. So, if someone says to me, I don't want to get the vaccine today," I hear what you're saying. I understand you probably have some concerns about it. I'd love to chat with you about it. Do you want to talk to me about why what your concerns are, and what your motivations are? I assume that you've probably heard a lot of good things about vaccines. What are the pros and cons that you've heard so far? And then just listen, see where they are.
Yeah.
So other comment. I mean, don't worry, we'll get you there. Other comments in response to the SP?
Me?
No, just other people. I mean, I think you did a really good job of answering that question earlier. So I would like other people's comments now.
I think for me, I wasn't expecting the patient to have all of this research that she came in with, which was just a bunch of basically fake information, because it was the COVID vaccine, obviously, and it was talking about like how it causes infertility, and she was really, really just stuck to that no matter how many times I like tried to convince her out of it. So it was a little hard, and I have to admit, I was stuck. I really didn't know kind of how to.
So when you get stuck, what do you need to do? What are some of your first thoughts? This is where going into the motivational interviewing session, if you get stuck, this is something that I would sit down and reflect on. How do you actually get unstuck from what can you focus on?
I would say like what you said, how we should need to address or basically to listen to them and see what they think the pros and cons of the vaccine are, just to listen to their side of things, just to make sure that they're heard. But then I know I don't want to come back at them with all of the science that won't make sense. Because another thing with my SP was that she was very convinced that like the CDC, just the government was after her and everybody else. So she wasn't even, I think she needed the vaccine like for her job. And she said like she would quit her job for it, like to not get the vaccine. So
instead of using evidence, we've talked about this, what does work?
I'm blanking on this one.
That's okay. No, it's okay. Anyone else want to help?
So I don't know if I did the right thing or the wrong thing, but the way I tackled this, just because I was in a fertility clinic when like COVID kind of was at its peak. So we actually had a lot of patients that kept asking us these questions like, oh, my husband wants to get vaccinated because we want to get pregnant, but like we want to have the vaccine before we get pregnant to not have any complications. But then it like lowered sperm count. So what we would tell them is just that like after 3 months it would go back because sperm just keeps it just keeps like
okay.
Men keep making.
I'll just tell you, guys would believe it because they're like,
I know, and I think I know
it's always going to be high, right? Like that's a great argument for a guy.
But I did tell her like, even though I kind of like told her too much, like maybe too much information, but
Yeah.
eventually like I summed it up as these are kind of like short-term effects, but like a COVID vaccine is like more like of a long-term effect. So I told her to compare
Let me just
those.
tell you how that's coming across, and you tell me I want you to process that, and I want you to tell me what you
Okay.
think. So what you're telling me is you're telling me information and evidence.
Yeah.
Do you think that's a fair characterization?
Yes. So what you told us not to do.
So how can you just twist that just a little bit to get the same effect or to get the better effect?
Um,
I'll give you an example. We've been running vaccine clinics here for we've vaccinated, thousands of people here. In our experience, that we haven't seen any of that. We see, dozens of people a day. And if that happened, it would be something that would probably show up on our radar screen. And I understand I hear you on your distrust for the CDC and the FDA, but our experience has been that we don't see that as a concern. How do you feel about that? Are we presenting them with evidence? We're telling our personal experience. So if we go back to the EBM triad, right? When we talk about this, what am I sharing with them?
just your experiences, what you've seen firsthand, not really
Yeah,
facts.
I'm an authority figure in this role. Authority figure is not the right word, but you get the idea, right? My experiences suggest, and if they have trust with you and a connection with you, do you think that holds a lot of weight with them? And when you're doing the SPs, you can rely on fake information because you're not medical professionals. And this is a patient encounter, and you can assume that you've been doing this a while. And you could also fall back on your clinic. Our clinic's been giving this vaccine for quite a long time, and we just haven't seen those effects. We've seen other effects. There's definitely things that pop up here and there. They're mainly minor, things like, and then this is where you distract them. We can see a lot of people who get a lot of, sore arms or, are knocked out for a couple days. That's what we mainly see. Occasionally we'll see something where, we have it a little bit more extended situation because the numbers bear that out. However, it's not very common. Most people get over it in a day or two and they're back and, they get a little bit of protection. Does that sound like something that might work with patients?
I've actually used that approach like as I was about to give them the vaccine. Like, so I don't like when I was vaccinated, I don't like seeing people nervous or apprehensive. Like, I want people to be like confident in their decision. So whenever I'd be like, okay, we're getting this vaccine, do you have any questions? And then I can kind of see them being like, no. And then I would ask them, I would be like, are you feeling okay? And they're like, I'm just a little nervous. And I'm like, okay, well, tell me why you're nervous, or what are you afraid of? And a lot of times they'd be like, oh, the pain, or I just don't know what to expect. And then I would tailor it for women and tailor it for men. Just saying like, this is what we like for women. I would say like, we expect a little bit of soreness, COVID arm you've heard before. For women specifically, we might get like lymph nodes in the breast tissue that sometimes comes up. Have you heard of this before? They go, oh yeah, I've heard of that. And it's okay, it's normal, it hasn't happened before. And then just continuing to talk them through their fear. Because I think for me, like, as a vaccinator and like as a future physician, like it makes me nervous when my patients are nervous. So I want them to be confident, and it just like puts us both at ease. So
yeah, I don't want anyone to feel like you're not like bothered by your first SP. Like the reason we're doing this right now is because we want you to kind of reflect on this in a safe environment, right? There's no consequences to that. So now, guess what? You get the opportunity to kind of see if you can practice a little bit. It's not going to be perfect. It's not going to be perfect. You might have noticed that I've been motivational interviewing you through this last half of the session. Been asking you a lot of questions. What do you think about that? Do you think that's evidence? Right? You can do this in all aspects of your life. If you get good at it, your spouse will just be eating out of the palm of your hand if you're really good at it. Now, having said that, my wife would never, I'm not good at it. So and she's often making me, I'm like, wait a minute, are you motivational interviewing me? So wait a minute, you
We
want
all
to
do
go
it to
where?
each other as students, like all the first years are like motivation interviewing each other to study. Like,
Well, the truth is, hopefully you come to, like, even if you're doing it to each other, you have a shared goal, right? So that's the first step in this process. So if you have a shared goal, hopefully you can kind of bring your motivations and your interests and your feelings and the information in line with each other and come up with a better outcome, regardless of what it is. So, okay, how are you feeling about next in 2 weeks in SP? And to know how are you feeling about things?
I'm sorry, I have one last question, if that's
No,
okay.
please. Yeah.
What about patients who like just don't really understand the consequences? Like they think it's just like not as grave as it is, like how
Mhm.
complicated things can be. Like a lot of people say, oh, like I don't want to get the flu shot because I don't want to be sick the next day. Or, oh, I don't want to, like, I already had COVID. I don't want to get like I don't want to get a vaccine because it wasn't that bad or it doesn't affect me that well. Like it's not as severe as like, so how do you kind of talk through them with like in that scenario when you can't really give them like side effects because they're already aware of them and that's the reason they don't want them?
Yeah, the one that I always get, and I used to be really obnoxious about it. The one that I always got was, because I used to teach at a pharmacy school, right? And pharmacists get vaccines in a lot of states. The one that I always got was, well, I got sick from the flu. That did happen in the past. It does not happen now. You do, that's your immune system responding. Well, that's how I used to respond to them. Is that positive or effective? No. They're going to be cognitively dissonant. Maybe a pharmacist, I can be that a little bit direct with them and be, they're a healthcare provider, you know better. Get your act together, son. But this is not that is not probably a positive situation, right? So what I would say, and this is really challenging because you're going to be balancing. The thing that you can't do is bring other people's motivations, like well, you're helping out other people. I used to do that all the time, thinking people had that motivation. People primarily care about themselves. It's a sad reality, but you can't expect to convince anyone. Honestly, it is not an easy scenario. You're going to have to get them to think about what influenza can do, okay, and how it would make them feel. The big one thing you can do is talk about, hey, some of the biggest people who are at risk. One of the reasons we do this is obviously we don't want you to get sick. You probably can't afford to be out of work, right? Are you concerned about being out of work, or are you concerned about? And this is a pretty big one. Do you have any family members who potentially, are elderly or immunocompromised or at risk? Because if you do, you'd probably feel really horrible, right? You're not appealing to their sense of, you'd feel really bad if they end up getting sick based on what you did, right? Your lack of vaccine. So what we're really trying to do, you're really focusing on their consequences because they're going to feel bad, right? Empathy is a fine line with people and selfishness.
Yeah,
And so
that was something with my SP, because I told you like she was going for a job and it required the COVID vaccine. So I was trying to explain to her like a lot of times the vaccine is so you can protect others, like your family, or your friends or your coworkers. And she just responded how she doesn't have anybody and how she doesn't care. So
a lot of people will respond that they don't care. So you have to see if they have someone in their life, because otherwise, and so you may not win that argument.
Yeah.
You know what I'm saying? It may
Right.
not be clean.
Right.
You may not have a good answer to that. Your shared response would be, it's the best long interest for your health, but they can be like, and that argument is so, the balancing act that you're doing there is so small and the consequences are so small that it may, like, influenza out for a couple days. Yeah. And that may be the decision you have to make with them, that you get to them. You can argue a lot about, not argue a lot, but you can discuss a lot about what the consequences are. I'm sure you don't want to be out for work for a couple days. You probably had a man cold, or you've probably had a cold that knocked you down for a couple days. That's what we're trying to prevent. We're also trying to make sure that I'm sure you have a mom and dad, and if you get this vaccine, you can feel a lot better about going and visiting them because you're not going to transmit that. Notice I put it in their frame of reference, which is you're
Right.
going to feel a lot better about not passing that on. And that's
Okay.
probably all. If someone else has any other exciting ways of passing on, influenza is the toughest one, right? Because the vaccine commonly will give people side effects, and the side effects are commonly just as bad as the disease. Does that answer your question?
Yeah, definitely.
Okay. Chris? We can't hear you. You probably muted so that in your speak so that it doesn't reflect and reverberate in.
I'll just talk through Antonella's.
Okay,
I don't know
sounds
what's going
good.
on with mine. Oh wait, except for the part I cannot hear your response. Thank you. So I was going to ask, can we have an SP where we're trying to motivationally interview medical students to get the flu shot who don't want to have downtime or concerned that they have downtime from it, or they won't be at their 100% best during, like, before an exam or something?
Yeah, please do.
I feel like that's a common scenario.
Oh, absolutely. You are all sick all the time.
Mhm.
You spread amongst yourself. I mean,
I'm not taking it. It
the
only gives you 60%. If it has like about 50 to 60% efficacy, it have all these side effects. I'm like, I'm sorry. Like,
what should I not
Neuro, I
say
can't
to a
take
mean? What should I not say to a mean?
facts.
Don't tell them facts. They're not going to
Yeah,
work.
no,
He's
I
too
mean, I
smart.
certainly appreciate that perspective. Like, I understand because it could knock you down for a day or two, right? And so I hear what you're saying, and that can be really damaging in the middle of neuro, especially. But what if you
Well,
got
I
sick in the
mean,
middle of neuro?
yeah, what if you got sick with the flu during the middle of neuro? I mean,
Because
how
if
much
everyone
time
does
would you have to
that,
spend then?
yeah. How
Right.
which is the bigger risk? So
My dad actually used that argument with me for a long time with shingles. And he's a typical blue collar, work till you die, like no days off. And so I was like, he goes, I can't take time off work. And I'm like, well, Dad, the pharmacies are open on the weekends. What's your excuse now? He goes, I don't want to be sick on a Monday. Okay, we'll get it on a Friday night. What's your excuse now? And it was like, it was weeks of it, like trying to get him to like finally do it. And then it took someone coming in with shingles, that one of his clients coming in with shingles, and he was like, that's what happens when you get shingles. And
yes.
that weekend we were in.
Well, and this is where, so how do you present that, right? Dad, I saw someone with shingles today. It was horrible. They had a rash all the way up down their side. I've heard of people being stuck in the hospital for 3 or 4 months. One of my SPs gave me a great example of someone being in the hospital for 4 months with shingles. Right?
It was the same thing with COVID. Like it took him seeing he had a friend who got sick with COVID, and then he was fine. He was, look, he got COVID, he was fine. But that same friend had COVID again, and I ended up hospitalized. And then he was like, I didn't know you could get COVID twice. And I was like,
you know what convinced my folks to get the COVID vaccine? I had the same exact discussion with them. They're like, so-and-so's gotten it, and they haven't been bad. And I was like, Mom, I need you to think about this for a minute. Okay. How many times have you gotten sick and it hasn't been fun recently? Because she's a really big believer that, she has Epstein-Barr and CMV. And I was like, and you want to take that risk, right? So those are things you can do to assess the situation. Shingles is a much higher impact stakes than influenza. And going to Antonella's point, which I think is a really amazing one, because you will have this almost every year with influenza. And it's justified in a lot of people's brains. And I actually I now get the vaccine every year, but I actually, and we're creating dissonance in Amin's brain right now. That's why he's asking a second question. But the truth is that shingles is actually, there's a lot of these diseases that have a lot higher stakes than influenza. So to Antonella's point, you may just have to leave it there and hope that they process it.
Yeah, no, I was just joking. If I have access to vaccine, I'll take them.
Well,
If
you
they're
probably can't. I think they make you take the influenza vaccine, don't they?
I'm not sure. Maybe other vaccine, yes, influenza. I think I'm not sure, but they
Well, I'll tell you, you will take it in your 3rd and 4th year.
yeah, that's true. Yeah.
Yeah, I mean, there's certain things that like, and I'm not trying like, I mean, I didn't get the influenza vaccine for years. When I was your age, I never got the influenza vaccine.
Okay.
Right? And I feel guilty about it. I don't really remember getting influenza either, though. You have to make these decisions are personal, like they are personal, and so that is I mean, you have to make a risk assessment, and I don't know, like if there's certain vaccines that are not justified. Like I told you, I haven't got the booster, the Omicron booster or the Delta boosters or whatever is in those. I don't remember which ones. There's a Delta and an Omicron in those. I didn't get those boosters. I didn't feel the need to. I'm not rushing out to get it. I've had COVID multiple times. It was very minor. In fact, I had a little bit of stuffiness and that was it. And I feel like my immune system is handling it pretty well. I've had the other boosters and I'm fine. So does that mean I'm making the right decision? I don't know. It's a good question, but I have autonomy to make. And honestly, I'll probably go in a few months to get it because when it was available, I had just gotten over COVID and I was like, well, I'm not going to go get it now. That's dumb. My immune system already took care of it. So maybe I'll go get it in a few months and then make personal decisions across time, all those kind of things. So any other last thoughts? We're kind of going over time. This seems to be like a very important topic to people, which is good. I really appreciate it. And Tanel, that was a really, really, really good question. So I can't emphasize it that you're going to face that a lot with the influenza vaccine. Almost every single one of you is going to face that. Shingles is a different ball game. All the other vaccines, they're different ball games. Because you can actually be like, hey, I really appreciate the fact that the meningococcus doesn't seem like it. You probably haven't heard a lot about it. You know why? Because the vaccine works. But if you get meningococcus, there's a high probability. I've seen patients, boom, right? There's not a high probability. I've seen patients. I've had several patients who have been put in the hospital and been down and out for weeks. And I really would hate to have that happen to you. All right. It's been a very fun evening.
Maybe our final should be motivationally interviewing you, Dr. Brooks, into getting the new COVID booster. Do you have any children in your life that you care about, Dr. Brooks?
I understand your autonomy and I respect that, but
that's so awesome. Yes. I think that's really a good point. And Amin, we've already created a lot of dissonance in Amin now, and Amin's going to go get his influenza tonight.
Next visit,
see,
we're gonna.
He's already on board.
Next visit, and then we're gonna talk about this. Okay, how does that sound?
On Monday, I'm going to get my new vaccine for the booster, thanks to Chris and Antonello's.
We're joking, Dr. Brooks.
I'm
kind of joking too.
Where was the invite? You guys are all together. What is this?
We're all friends.
Utah is small. It's a small town.
Oh, are you guys all in Utah?
Yeah,
we're all Utah.
It's nerve.
I'm sorry.
We even brought emotional support plants into our study room. So just so you know.
Thank you, Dr. Brooks, for the good discussion, everyone.
Yes. Thanks everyone for coming tonight, and we will definitely I'm excited to see how you do on your SPs. Just spend some time thinking about it. You're going to do famously. I don't expect to be perfect. It's never perfect. And so just have fun with it and work on your technique. Think about how you're going to approach the question and how you can do a more effective job in that process. So I know you're all going to make me proud. So all right. Have a great night. We'll see you in a week or two. Emily, 1 minute. Oh, did I lose her already?